and that's where that fear of the cancer also comes in. You may know something is wrong with your body because you can feel it, but they just don't want to know because it's like they feel like there are no options. They may have come from places they didn't have access to healthcare, and the access that they knew wasn't very good. And so they felt like if they would go to the doctor, there wouldn't be very many options. But in reality, you do have options, and the longer you wait, you're delaying those options, like what your treatment could be.
Hey everyone, welcome to season 3. This is Shauna.
And this is Rosalina, and we're your hosts for Too Young for This Shit podcast. This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. Hi everyone, this is Rosalina.
And this is Shauna. Welcome back to another episode of the Too Young for This Shit podcast.
In this episode, we will speak on the issue of health disparities within the Latino community, specifically focusing on breast cancer, but we'll also touch on other areas as well. Our guest, Andrea, of Mexican-German descent, is a young breast cancer survivor and a dedicated advocate working to create better health policies in her job role. We'll explore Andrea's personal journey with breast cancer, her role in health policies, and the initiatives she has spearheaded to improve patient outcomes in the project she worked on at the community clinic in Orange County, California. We will also address cultural barriers, healthcare disparities, and the crucial role of health literacy in the Latino community. Lastly, you may have seen her on the Kelly Clarkson show last October, where she was a special guest, our podcast listeners that the network brought in for the Too Young for This Shit podcast segment. So we're especially excited to talk to her again. That's how we became friends. So if you haven't seen our Kelly Clarkson segment, we'll link it in the show notes below. But thank you so much for hopping on to this episode to speak on this important topic. Welcome to our podcast.
Yes, welcome.
Thank you so much for having me. Thank you both. I'm so excited to be here.
I remember being in the back room of the Kelly Clarkson show and talking to Rosalina after, and I was like, we have to get her on. We have to get her here. We have to talk to her. I want to hear her story. So I'm really excited to have you here. Thank you.
Oh, thank you. I remember just being really nervous and everything happening so quickly, and then just meeting for a little bit, and then it was we went our separate ways, but we stayed in touch. So it's nice that now we have a second to talk. So it's really nice to have to be here. So thank you both.
Yeah, perfect. So let's start off with the topic about your inspiration with pursuing career in healthcare. So off mic, we spoke about being a child of an immigrant. I know you're first gen, and you navigated the healthcare system from a young age, handling prior authorizations for your parents, which is incredible as a young child, just doing all of that for your parents. Bravo to you. When you were 16, you started working in healthcare officially. Did these type of experiences influence your decision to get your master's in health policies, or what was it that really sparked?
Right, absolutely. So I was actually always interested in medicine. I think I like the idea of solving problems and then making an impact. So as you said, I started working really young. I started volunteering as a translator, actually. And I think the first thing that I saw was that there's such a need for Spanish speaking providers. I don't know if you've ever been to a hospital or a clinic, and there's such a lack of providers, healthcare providers that speak Spanish. And that's how I was able to actually start working, was because there was just such a need. And I think seeing how difficult the healthcare system was to navigate, but then again, when there's a language barrier, combined with just how much I love to fix things and to solve things, just kind of added fuel to the fire. It's interesting because my career has taken some really interesting turns, but eventually I left medical school in my third year. And my focus has really stayed the same, right? To ensure access and affordability. And now I can do this through health policy.
That is so awesome. And bravo to you to just jump in and to help out people who their first language isn't English. So that's really difficult to navigate, even like the healthcare world. You made a difference at a young age. So let's dive into your breast cancer journey and talk about living in Budapest, Hungary. And that's when you were diagnosed. Being in a foreign country, not being near your parents, your family. I know you had friends, so I'm sure they helped you. But the diagnosis can be very lonely, especially living in a country that you don't really know the language. So, how did you navigate your diagnosis and treatment during that time?
Now it was kind of like the roles were reversed. Now I was a person who didn't speak the language and needed help navigating a completely different healthcare system in Hungary. So it was a lot. It was extremely overwhelming. I didn't try to do too much there because I really wanted to come back and really have my surgeries and my medical team here in the United States, but I needed to have my lumpectomy there. And just trying to schedule things and like find providers who spoke English was really hard. Find providers who would like sit down and walk things through with me. And a lot of the support that I had was also from English speakers, so people who didn't speak the language either. So that was really tough. And I just remember when I went through my own diagnosis, those first couple of weeks, especially of just finding out, it was extremely overwhelming. Just not understanding the healthcare system, just not speaking the language. I just remember being really, really scared. I think those 3 weeks were really, there's a lot that I don't remember, honestly, because it was just a time where I was just trying to piece things together, put one foot in front of the other, and trying to figure out how can I get back to the US. Also, I didn't have insurance in the US. So that was another hurdle. I had to get insurance here. It was one of the most overwhelming times, I have to say. On top of that, it was during COVID. So it was just like, it was a lot.
I want to break this into pieces and like, I want to process this because this is a lot. So, one, you mentioned that you had to do your lumpectomy in Hungary, but then I remember, I think you mentioned that you did your double mastectomy here in the US. So, was the reasoning why you did the lumpectomy in the first place just to remove the tumors, just so you don't have to worry about that? It's like a peace of mind.
So they originally recommended that. They said a lumpectomy would be fine, especially because you don't have a history of breast cancer in your family. When there's a language barrier, there's so much that you don't understand.
Yeah.
Like my surgeon couldn't explain things well enough. Sometimes they rely on translators who are not in healthcare, like other patients, for example.
Right.
That's the extent to where they didn't have, and we do the same thing here. How many times do we have translators who were family members? Like, how well are they able to translate medical information, you know? So I remember I woke up after my lumpectomy and they had actually removed lymph nodes on my left side and I didn't even know. And I was shocked and I was so upset and I was like, can I talk to somebody? And they were trying to just like with hand gestures explain. And I was like, can no one explain to me? I don't understand. No one told me beforehand. Then that's when they told me there was more. Now we recommend a double mastectomy. And I was like, well, when did this happen? When there's a language barrier, when you can't communicate things effectively, when as a patient you don't understand, you're not a part of the decision making. These are the things that fall through the gap. And these are the things that I remember now. Like, these are the things that we don't want patients to go through. You have a right to be involved in all of these decisions and to understand what's going on and to be able to make decisions with your team. This is why health literacy is so important.
Yeah.
So you said within 3 weeks of your diagnosis, you ended up having a lumpectomy in Budapest. Then what was the time frame from your lumpectomy to your double mastectomy back in the US?
It was 2 months. So first I had to get health insurance, which I got. Then I had to go through a series of some prior auths to see an oncologist and a surgeon. Then I basically just had to choose what I wanted. Luckily, because I had the lumpectomy, the tumor was removed, there wasn't such a sense of urgency. I had a little bit more time to kind of process. what was going to happen from a physical standpoint. But I remember going in and still, I was terrified. I don't know if I'm ready for this. I don't know what I'm going to look like. And I still had so many questions. Each time I would go to the doctor, I had just like a list of questions.
I did not know this, by the way, that you went through all of this.
Every time I talk through it, it takes you back, and it's a lot for anybody.
It really is. And like what you mentioned, you don't really remember much, because I think that you like blacked it out, which I totally understand, because I've blacked out some of the parts that I went through. I don't even like remember things here and there unless I listen back to the podcast.
Same.
And like, oh yeah, I went through that. I did not know.
There's been like quite a few times I've had to go back and try to like piece together what had happened. I mean, medical trauma is just so real in general.
Yeah, it absolutely is. There are things that sometimes I think about and I think, oh, did this really happen? Oh, it did, because I talked about it and I wrote about it and so-and-so told me. But there are pieces that are so painful to think about that I have tried. I've talked about them in therapy, but they were physically and emotionally so difficult that I've had to just put them aside. To be honest, that day post lumpectomy, to have something removed where you didn't really consent to, and it wasn't talked about. I remember it was so traumatic for me waking up to the point where I don't even remember how I got home from the hospital. And I was like, who picked me up? To that is still a mystery to this. I was really distraught. It was a lot for me to be in a foreign country where you don't understand. It was one of the most traumatic things.
I couldn't even imagine. Their daughter is in a foreign country, and I don't know. I mean, my parents lived the US, but they lived on the opposite side. So I feel like we have a little bit of a similar journey where they couldn't help me as much because I was living in Seattle at the time and then Los Angeles, and they were in New Jersey. So I'm sure that your parents went through something similar where they just felt hopeless that they couldn't help their daughter. Yeah. How was that?
I don't know if you went through something similar, but sometimes I felt like I didn't lie. I didn't want them to see how much pain I was, because I knew that they couldn't do anything. Yeah. They couldn't come over because it was COVID, and I couldn't go yet because there were COVID restrictions.
Yes.
There was a time frame that I had to wait. And I knew that if they saw how painful it was, the extent of the pain, it would just hurt them. I waited until I saw them in person. And I don't know if it was similar like that for you, but I just remember that phone call when I told them. It was almost like trying to reassure them, so this is happening, but we're going to figure it out. It's okay. Do you have any questions? And there was just silence. So.
Yeah, I think I was a little bit more open with my parents. In the beginning, I mean, my mom is the person who I spoke to. Yeah. I FaceTimed her and I was in tears because I essentially felt hopeless, and the person who is supposed to, be there for me is my parents, my mother. I think later on when I was going through my treatments, I was trying to be very strong and not tell them as much, or not tell them the things that I was going through, mentally, physical aspect. So I think later on, that's when I decided not to tell them as much because I didn't want them to worry. So when you were able to go back to the US, and I know I believe you said it was 2 months after, what challenges did you face while obtaining prior authorizations for your own treatment?
I love my medical team. I love everybody, but I will say it's the insurance part, right?
Yeah.
The first one, I remember being so frustrated. So the first I immediately needed was, in order to see my oncologist, I had to see my primary care first. I couldn't go directly to an oncologist, and there was a mistake on that prior authorization. So the date was incorrect, the oncologist was incorrect, the diagnosis codes it was just all incorrect. And I was so frustrated because I had waited 3 weeks for that appointment. So I wouldn't leave the office. And I said, I didn't make that mistake. Your medical assistant made the mistake. You confirmed the appointment. I have the confirmation. So you're going to have to get on the phone with the insurance company. And I got on the phone with them as well. And I said, I'm not leaving. I'm not leaving because I waited 3 weeks for this and it's growing. And the oncologist is the first person I need to see. But then I also need to see a surgeon, and they're going to have to refer me. And the other option is to pay cash, right? If you don't have a prior auth. It was over $500. And I said, I'm not doing that either. So you made this mistake because I spoke to this person on this day and I had confirmation. So this is an error on your side. So you're going to have to deal with this. I'm not leaving. And I sat there for an hour. I said, you're going to have to do a retroactive prior authorization, which is something that can happen. It can be done. I feel like it's a secret, but it can be done. So, when you feel like you've done everything you can and still you're just almost like running through mud, that's what I felt like. I had gone through the process, I had waited, and I was not leaving. And my mom was like, well, let's just, maybe we can. I said, no, we're not coming back because then it's going to be another 3 weeks and everything will be delayed. I'm not leaving. And so I didn't. And I saw who I needed to see. And then I got my other referral for my other surgeon. And I had to wait another 3 weeks for that prior authorization. I said, but this time I'm doing it. It's really frustrating. And people shouldn't have to feel like that burden of the money, of the bills, of what's my out-of-pocket costs and what's my deductible. And is this in network? Is this out of network? And it's a mess.
You're going through the process too. I waited, I made the appointment, I'm waiting, I'm doing everything I'm supposed to be doing, right? And it's such a loss of control when that's something that was so out of your hands. To then be like, but good for you for being like, I'm not leaving this office. Because not a lot of people do that. Nobody wants to rock the boat. And I think that for the fact that you said, I'm not going, was like a great way to advocate for yourself.
I almost didn't want to say that. I do feel bad because I think I was probably a little too aggressive. I think I felt a loss of control. I felt a loss of control of my own body, a loss of control of the entire situation, of everything. People don't realize what a loss of control you feel. And especially for someone like me who, I know myself, I know that I like to control things. And this was also a huge test of that. I see how much I've grown just in terms of just being more flexible and being okay with, you can't control everything. But in that time, like 2 years ago, I wanted to so much control everything, and you can't control everything. And it was just so hard for me to understand that. Like, I remember meeting with my oncologist for the first time. I was like, okay, we got this. Like, how much until I'm cured? Like 1 month, 3 months? Give me a timeline. She was like, I can't tell you that. And I was like, well, you better tell me. Like, and it's like, you can't. And it's just, you feel such a loss of control. Your body is almost like betrayed you and there's nothing you can do.
Yeah, I feel so many of us have felt this way. I resonate so much with what you said of being like, even now, like I felt like I needed to be in control the entire time I was diagnosed. But then now after, I'm so much more flexible. Like things don't bother me as much. I feel like a little bit more relaxed, but that wasn't that person before. So I resonate with that so much.
Yeah, it's a growth moment. Yeah.
Yeah, I also resonate as well. Like when you mentioned about a timeline, like that's where my head was at too. When I met with my oncologist, I wanted her to give me a timeline. I'm not going to be fucking sick forever. This is out of the ordinary. I've never been sick like this before. So I definitely understand where you're coming from 100%. But I think going back to what you mentioned, you felt like you were a little aggressive, but you have to do what you have to do. If someone fucked up, especially when you're trying to get the care that you need, like you had cancer. So you need to see the oncologist in order to get treatment.
Yeah.
You don't want to wait another 3 weeks, like you mentioned. That is just not acceptable at all. So
3 weeks is a long, like it's hard to get an appointment, and like to wait another 3 weeks, like that's a long time.
Yeah.
So yes. Thank you for saying that.
Getting healthcare in the US can be exhausting, but I think at the end of the day, this is how the system is for right now. And we have to push forward. We have to do whatever we can because no one's going to look out for our health. It's at the end of the day, it's our own. Right.
Nobody wants to be the pain in the ass, but be the pain in the ass.
I remember in the beginning of the episode, you mentioned that when you first told your parents that you were diagnosed with breast cancer and it was silence, how did that make you feel?
So I didn't actually say breast cancer because I didn't want to like scare them too much. So I more said, look, we found a lump and I need to have surgery and I'm going to have some other treatments, but we're going to figure it out. It's going to be okay. So I do have to preface this by saying that we have a history of cancer in my family. So we had to talked about cancer, but this is also why it was like that fear was very present for them. At the time, my dad's dad had already died of colon cancer, and my mom's dad, he was in hospice for the same thing. So we didn't even tell my grandmother I was having my mastectomy. I had my mastectomy, I think, like a week before my grandfather died. So it was a lot going on with our family.
Right.
I think cancer is a sensitive topic, not because we don't talk about it, but because it's just been around so much. But I mean, we had never talked about breasts. I remember we were sitting at the dinner table one night, and I was more so like informing my parents, this is what my options are, and this is what I think I'm going to do. What do you think? Because I had already kind of decided, like I was going to have the mastectomy and I wanted the immediate reconstruction. I was going to get implants. And I was trying to explain like what each surgery was and everything in a way that was easy to understand. And I realized we had never really talked about breasts or my breast, like my body. I think my dad was a bit embarrassed and just kind of like didn't really look and didn't really want to say anything. I think that's why he was silent. And my mom, and not to say in any way that she didn't agree, but I think it was just like, first of all, everything was just such a shock to her. And I know that she's supportive. It's just that I think her immediate reaction was, well, you don't need them. Like, you don't need implants. I think in her mind, she thought like implants, breast augmentation, like it wasn't really like clear to her. And that kind of opened my eyes to, we don't really have conversations about this in my family. We had never talked about breast cancer. We'd never talked about reproductive health. We'd never talked about sex. Like, we're a quite conservative family. And so that's where my answer was, I didn't ask you. And we just left it there. And from that point forward, they were very supportive, but I remember that feeling of, is it really okay? Am I doing something wrong? It felt weird. Again, it was just the first time we had brought it up.
Going back to the conversation that you're having with your parents and how your mom didn't want you to get implants, I remember you and I talked about like you kind of felt ashamed, had trouble expressing your needs when talking about that. And of course, you mentioned that you said no one asked you. I wouldn't do what I want, essentially.
I respect my parents very much, but I'm also like, just by my answer, I didn't really ask you. Like, I recognize that I'm an adult, but I never want to do anything that would hurt them. And so that's why I felt like in a very tricky position, because I wasn't sure if I was doing something wrong just from their reaction, because I asked them, like, this is what I'm thinking of doing. What do you think? And my dad, on one side, I had my dad who wasn't really saying anything. Not because he didn't agree or like, I just didn't know. I really didn't know. This was a time, like you mentioned how you talked to your parents and like they were like your go-to. And for me, again, I want to reiterate, like they're very supportive. I love them. It's just, I think because they had relied on the fact that I had worked in healthcare for so long, I had taken care of their healthcare staff for so long. And I think they even said at some point, my mom said, like, I just wasn't sure how to help. And they were helpful just by being there, by being supportive. But when it came to like medical decisions, I think it was very overwhelming for them. But going back to this, like the breast implants, like they weren't sure. My mom was like, like, are you trying to get a boob? I think she just didn't know. She just didn't know what I was trying to do. That was her first reaction. And my defensive self was like, well, I didn't ask you. And that's why I felt, I guess, bad.
Did you say I'm choosing to do reconstruction for like a sense of normalcy I'm young, I want to have some sort of a breast there? Were you able to have that conversation later and kind of separate the fact that reconstruction obviously is not a breast augmentation? This is not a boob job.
So immediately I let it go because I felt so exposed, so like vulnerable. Like I could already feel like the lump in my throat. When you feel that, you don't have it in you. So I was very fragile, to be honest. I think a lot of people thought that I looked very strong, but inside I was really fragile. I was dealing with a lot. It was really a lot. Even though I may have appeared strong, I keep a lot inside. But we've slowly talked about it. And I think just even like talking about my work with them, they're able to like see things in a different way. And we're able, like our communication has just improved substantially just by what I've been through. So I think we talked about like how I feel like I've gone through a growth and just like being able to let go. I feel like our relationship has gone through a growth and just like communicating things on a different level. but it's taken time. It's really taken time. Things that like we haven't been able to talk about before, like we can now. It's just different. But yeah, there's been a shift.
How were you able to get both of your parents on the same page? Did you go to therapy? Did you just sit them down and just say, these are the things that I need from you? I'm just curious how you were able to do that.
So I think they saw how honest. So two things. I've been open about how I've gone to therapy. Even though I've seemed strong, there's a lot that I've had to process. And there's a lot that like internally I've had to navigate and deal with. It's not a sign of weakness to cry and to go to therapy and to talk about things and to do certain things that sometimes can be seen as weak. It's not. And so just talking about these things, I've been very open about just sharing my journey and also the fact that I've gone to therapy. I don't know how much I want to go into like with their personal journeys, but I will say that they have gone to counseling, and which I'm very proud of them for, because it's something that 5 years ago, if you would have told me that, I would have said like, really? And now they have. But again, it's I think when you see what your child has gone through and you kind of feel helpless in that way, and then you see that like they're willing to share their experience with you and share what they've been through and be vulnerable with you, it makes you see things in a different way. And also, like, I really admire my parents so much. They lost both their parents to cancer. My mom, of her sister and her father. It's a lot. They've been through a lot.
Has going through, all of that, and then obviously watching their daughter go through cancer, like, has that pushed them to maybe seek preventative care and seek going to doctors and checkups and things like that?
Yeah. So we talk about health a lot, but I think now, whereas before they may have been like, oh, colonoscopy, it's painful, I don't really want to do it, I'll do it later. They are on top of it, and they make sure not only to do it themselves, but like to tell other people, did you get your colonoscopy and did you do that? And I think they're very proactive about it. That's something that I'm also very proud of them, because I feel like they're trying to take control of their health. So they're very much trying to be their own advocates, I guess. So I'm very proud of them for that.
Love that.
Yeah, I was going to say that is such a huge win, just coming from parents, from what it seems like, to really be silent with what they're going through and not maybe even taking their health that seriously until that developed. And it seems like they are taking proactive measures to do that. So really bravo to them, because not a lot of people do that. I will say, I remember you talked about how in the beginning my parents were a bit open with my cancer diagnosis, and yes and no. My mom in the beginning and my aunt and her cousin, there was a period of time where they didn't believe that I had cancer. So they were in denial about it. So that was really hard to go through, because even though, like, yes, my parents were there for me, but they didn't think or didn't believe that I did have cancer, which it was a little hard to go through, because how are you supposed to convince someone that I had cancer? So my mom, when I was going to do my single mastectomy, I talked to her about maybe doing the other side, maybe doing a double mastectomy. And she was like, what? Why would you do that? She didn't like really understand. At the end of the day, I did make my choice, and my choice was to do a single mastectomy. But if I were to go towards the other route, I think it would be harder for her to understand exactly why to do that. My father, on the other hand, would understand, because when I was diagnosed with cancer, he mentioned to me, he was like, oh, do you know Angelina Jolie? And he was telling me that like she had the BRCA gene and she had to do the double mastectomy. So like he understood exactly what she went through. And so I was really surprised. Like, yeah, I just wanted to explain that, because it wasn't all rainbows and butterflies with my parents. I did have to go through some obstacles with them as well.
I think there's always a bit of a learning curve, and it takes some time. You never know how someone is going to process. And again, that's another thing that like we can't control. And it's like, Take some time. We don't know. It is interesting that Angelina Jolie, my dad said the same thing.
Oh.
It's funny how people like
Okay.
remember that.
Yes. Well, it was a big deal.
It
Yeah, it was a
was,
big deal.
yeah. But I remember being at the dinner table and he was like, okay, so you'll be like Angelina Jolie. And I was
Exactly.
like,
Yeah.
and I make jokes sometimes that are not, but yes, I was like, well, in what way? What do you mean? But yeah.
So let's dive into your health literacy project and your role in improving patient outcomes. Just in layman's terms, can you tell the listeners what your role
Okay.
was in this project?
We wanted women in the community to feel more comfortable. So like we thought, what can we do to change this? So in this community healthcare clinic, we were looking at what are some of the biggest gaps where preventative healthcare could be improved. And it just so happened that it was a large Spanish speaking population, a large Latino community. Over 95% were Spanish speaking only, which is huge for a community healthcare clinic. Usually you don't have such a large patient population that is predominantly Spanish speaking that I had worked in. And there was actually a mammogram that was free to use regardless of whether you had insurance or not. But what we saw was that a lot of women weren't using them. So let's say in a week where you could schedule 20 appointments, only 5 were being scheduled. We were kind of wondering, well, what is the barrier here? Why are women not coming in? Because we know that it's not an insurance issue. From the data that we looked at, this community healthcare clinic, women that were eligible to get a mammogram between the ages of 50 and 72, something like less than 20% have had a mammogram. I would ask them when they would come in just for like other visits, for like sick visits or for other visits. I would ask, and if you're also interested, we have a mammogram. We can schedule you for an appointment or you can come back later. And they would say, oh, I don't need that. I don't use them. Or they would just kind of gasp and like, no. And we wondered, what are we missing? And we realized there is still this sort of like taboo in talking about breast and quite possibly talking about cancer, because a lot of them also didn't want to get colonoscopies. We looked at the colonoscopy screening for colon cancer, and a lot of that was missing too. So there's still this fear of cancer. And again, I had mentioned, I think earlier, that this was a patient population where 95% were Latino. And so you have to think about when you're looking at what is the barrier here, it's not just transportation, it's not just insurance, but also cultural. There is still a fear of preventative healthcare, of finding out if I have it, what do I do? What then? But also just in talking about things like the breast, of cervical cancer. A lot of women had never had pap smears. These are discussions that we would have with the team of how we could kind of change this and encourage women to get mammograms because they needed them. So why are women not getting these mammograms? That was kind of the focus of the project. It was very interesting. And a big reason is because the breasts are still seen as this sort of organ that is not talked about. And so it was kind of what can we do to change this idea? Because everybody in this age range should get a mammogram. One thing we can do is connect them with providers who speak Spanish. And out of 40 providers, healthcare providers, only 5 spoke Spanish. So can we change that? Can we connect them to social workers? Can we connect them to translators? And also just even sharing my story. So at first I didn't really want to tell them because I felt like maybe, it's not really my place or I don't know. But then I told them, I said, because I speak Spanish, I would say, I actually had breast cancer and I had reconstruction and I'm okay. But it's important to get screened. It's important to have a mammogram. It's important to know so that you understand your options if something happens. And then there was like a shift in their face, like, what? And really? And so it's really important to have these conversations in, I think, communities where it's still sort of like breast cancer is still seen as, it's not really talked about. That's why it's important to know, to get screened, to know if you have a history in your family, to know what your other risk factors are. Because if you don't know, then it could, your options might be more difficult.
Yeah, so you basically kind of looked at how many women who were eligible to receive mammograms every 2 years. Basically, you and your team were trying to figure out if the percentage was under or at the benchmark for patient outcome. And the patient outcome percentage benchmark that you were trying to reach was 75%, but it was lower than that. It was 45 to 48%. And so even if it's a free service at the clinic, women were still not going to get a mammogram. And so I thought that was a very interesting point, because sometimes it could just be that if it costs money, then people don't want to do it. If they don't have insurance or the funds to pay for that cost, then they won't do the service. But I found it really interesting that it was free and they still wouldn't do it.
Right, right. Yeah, this is something that, to be honest, it was new for me too. I wasn't aware of it, and I think we were kind of stumped for a little bit as well. And then we realized this is actually it's quite common. It's quite common because the director of mental health, she's Latina, and she had said, guys, this is nothing new. This is very common in the Latino community, and this is something that we're tackling like elsewhere. But I wasn't aware as much, and we were really brainstorming. Well, why aren't they coming? Because we were also providing Ubers. We were providing Ubers.
Right.
The mammogram is
Yes.
free. We were ready. We also have social workers. Like, if for whatever reason you need anything else, if you need treatment, we can connect you. The state of California has different options. It has like a Medicaid expansion, and we can connect you to that, and we process the application for you. There are some other fears there, like immigration fears, but we have the resources. And this was brought up to our attention, where she said this is actually quite common. Women just don't want, like, it's a sexual organ, and it's just not, it's still a new.
It's private.
Yes, thank you for saying it. It's private. And so I don't think I mentioned this, but I had this conversation with my grandma. I asked her, I said, because my grandma's Mexican, and I said, Grandma, have you had a mammogram? And she said, I think so. And I was like, well, you better.
You would know if you had a mammogram because it's uncomfortable.
Yeah. And so that's when I really realized it is very much a cultural thing. When we talk about healthcare disparities, this is very much where I've seen like a pattern. Women are not getting mammograms because it's still, thank you, Shauna, a private part. Yes, yeah. Absolutely.
Let's dive deeper into the cultural barriers that affect the Latino community. And, I know you talked about a few points, like the immigration status could be a reason why they are hesitant to even see a doctor. But I think more towards maybe even talking about cancer, or even doing like the preventative care for cancer. And so can you just name a few reasons why those barriers exist in the Latino community?
Yeah, so from what we've seen, it isn't as much ingrained to like actively seek preventative health care. You go to the doctor when you are sick. And even then, it's like you are strong and you can kind of hold off, right? And so this is kind of the opposite of what preventative healthcare is, and the way I've explained it. And a lot of patients laugh, and I say preventative healthcare is kind of like a car needs like maintenance. And so like you take your car and you get it maintained, you do like checkups, and like in the same way, you may not have anything wrong with you, but you need to go every year just to do like a checkup. And especially for children, it's really important. I mean, for everybody, but another thing that we saw was gaps in childhood immunization, just because they weren't going as often. Yeah. Because again, it's part of preventative healthcare. You go not when something is wrong, but before. You want to tackle it before. And that's where that fear of the cancer also comes in. You may know something is wrong with your body because you can feel it. I've seen patients where they've lost weight, they have pains already. The symptoms are there, but they just don't want to know because they feel like there are no options. They may have come from places. So the reason I talked about the immigrants aspect of it is because particularly in this patient population, a lot of them were recent immigrants. And so from where they were coming from, they didn't have access to healthcare. And the access that they knew wasn't very good. And so they felt like if they would go to the doctor, there wouldn't be very many options. But in reality, you do have options, and the longer you wait, you're delaying those options, like what your treatment could be. But to hear that word, for a lot of people, it means death. It's like
A death
it's like a death
sentence.
sentence,
Yes.
and it's very scary to say, you know, and it's really not. It doesn't always have to be. It's not that. And I think just by people hearing me say that, like, I had breast cancer, like, oh, you, but you're so young. Yeah, you know, and I'm still here. I'm okay. I think kind of helped. Oh, okay. But it's a very scary thing for a lot of people.
Thank you for bringing up that point, especially when they are an immigrant and they haven't received that care in their country. I feel that is such a good point because that is something that I have seen with my parents as well. When they were kids, they didn't go see the dentist or really their doctor. It's very, very interesting how the mindset and like what they're able to access is limited. And so they feel like it's probably the same thing in the US when entirely it's not. So that is very interesting point. Thank you for bringing that up. And like you mentioned, cancer as seen as a death sentence, I feel like that could lead to just fear, denial, reluctance to even talk about cancer openly. I know you talked about language barriers, but I think a part of that, and I wanted to get deeper into that, is when there is a language barrier, there's more errors to be inputted in the conversation where there could be a lack of information, misunderstanding. And when you don't understand something, you're not going to try to understand it. You're just going to be like, nope, I don't understand it. Like, I'm done. This is one, too scary to even like bring up, and two, it's like they don't even speak the language, so how can I even communicate with them? And that's something that you have experienced in Hungary where there was just no one really knew English. So it's like the same thing here in the US when not a lot of people speak Spanish. You know, you're trying to communicate with someone and they're trying their best, but you guys don't speak the same language. And so I thought that I also wanted to point that out. You know, we talked about limited access to healthcare resources, educational materials. So I feel like the lack of awareness about cancer is something that is an issue. I also want to say 3 more things. Fear of medical procedures. I think that is something else that we need to bring up and talk about, because I think that is a huge thing too. If you don't understand what type of surgery you're doing and you don't know basically why they're doing this, and you're like having a mistrust with your doctors, there is a lot of fear along that. And I would definitely say in my experience, I definitely had that fear. I was hesitant to even do the surgery because I was like, okay, well, first I need to completely understand what exactly you're doing. What is this? Just understanding a little bit more like what goes on in the surgery. That is definitely something that I wanted to bring up because I think that's necessarily true.
Well, even Andrea, like in your opinion, like
Yeah.
you had that experience in Hungary. You had that exact experience. You woke up and you were like, I didn't know X, Y, and Z was going to happen. And you feel that mistrust and you feel that miscommunication.
Oh my God, that will stay with me, I think, until I don't know when. But yeah, I think that's, you know, like legally a patient. And I remember even thinking, like, this is against the law. And they were like, no one understood me. I was just saying, I was going on a rant and they didn't even understand. I was like, you can't do this. Because when you sign a consent form, it has to be like in the language that the patient understands. I always make sure when we're working that like the patient understands what we said, and I'll say like, "Do you understand?" And sometimes patients say yes because they don't want to say no. Do you understand? It's okay to ask questions like, "Do you understand?" So we need to have consent forms in the language that they understand. Like if we don't, it's just not legal. You can't ask them to sign something if they don't understand. But I think I have that reaction now because, like you said, I've been in that situation where someone I was operated on and I didn't, where was that consent? I don't remember what happened there, you know?
And it only takes one time for that to happen for somebody to be like, I'm not doing anything. I'm done now. I'm not going back.
Yeah.
Yeah. So when you sign up for something that you thought when it's not communicated effectively, and then all of a sudden you found out that they did this other surgery, that fucks you up. That's trauma. That is trauma.
Yeah.
So there's that. The other two things I wanted to mention in terms of cultural barriers and why talking about cancer is not really talked about in the Latino community. So fear of discrimination, let's just say you did have cancer. You don't want to be treated differently around your family. And the thing about Latino community and like families, sometimes they could be very harsh. And sometimes they say things that are wrong or incorrect, especially for females. We have high beauty standards. And when we lost our hair, we lost our eyebrows, we look quote unquote sick. Sometimes men or other people in the family would make comments. And I know that's a thing. I think that's a huge thing where families talk. They like don't understand.
Do you think that this is something that could change just by talking about it more?
Yes, absolutely. I think it's just a lack of awareness.
I have a question.
Yeah.
Do you think that this is also, obviously, it's definitely generational, but do you think it's this younger generation now that is getting the older generations to talk and get all this preventative care? Like, do we have to start with them in order to get this changing?
Yes, 100%. It is happening. I think maybe not as a huge change as we want to see, but it is. I think social media does play a part in creating that change because more people, one, are talking about like the mental health, and now that's what we talk about with our parents. And so kind of shifting over to talking about the hard things, right? So that's cancer, that's mental health, that's like going to see the doctor, and just so many other things. It does start with the younger generation, the first gens, the second gens, etc. So I really do think that is the biggest thing that we can do to make that change, especially with the older people in our family.
Yeah, absolutely.
The other thing, lastly, I wanted to talk about was I think in our families, we tend to try to hold this persona of being strong, being resilient. And when we're seen as weak or like appear to be weak, that's just very vulnerable. And that's not a side that we show to anyone. We always have to appear strong. And I think that is an issue. Because I'll even say it for myself. I felt I had to appear strong for my family, for my parents. And my mother even wanted that too for me. I mean, like when I lost my hair, she was trying so hard for me to look like I'm not sick. So like when I went to see my family for the first time and I had hair extensions, she told me that like I should dress nice so people could see how beautiful I am and I appear strong and all those things. And I think that's like the wrong approach, right? It doesn't matter the way that you fucking look. I fucking beat cancer and I was only in remission for like a month. And you expect me to get back to living the way that I was before? Like, I think we need to come to terms and make it known that is not reality. That is not it.
I think I don't know if it's a similar thing for a lot of people, but I think I kind of mentioned like I wanted to reassure them, but I think I also to some extent wanted to reassure my friends. I was the first person that anyone had ever heard of that I knew that had this, and so in a way wanted to not pretend, but I guess I did. I was scared. So I wanted to also reassure myself, and so I wanted to, I really didn't know what was going to happen. All I knew was that they had told me that this is what I needed to do. And I had no idea. I felt like the rug was just pulled out from under me. Later, we kind of talked about this with friends and family. And they were like, oh, but you just seemed like you were always joking. And we knew you were scared, but we didn't know how scared you really were. And I was like, I was terrified. I had no idea what I was doing. I was terrified. Yeah. The first time my parents actually saw me cry was when they saw the Kelly Clarkson interview. And they were like, we didn't know how hard it was for you. Yeah.
Yeah.
So that was just the extent, I think, of how I was trying to just be like this, everything is going to be okay. I think really I was trying to tell myself it was going to be okay.
I feel like everyone tries to tell themselves.
I think we all go through a period of that in
Yeah.
survivorship. I believe
Yes.
that.
Yeah. Talking about the Kelly Clarkson show, my parents didn't really know I had a podcast. And so I told them that I was going to be on the Kelly Clarkson show, and I told them exactly why
I
and
like
that
that.
I had a podcast. But kind of going back to the period of time where, you know, I felt alone, I didn't really see anyone who looked like me telling their story. So that was one part. The other part was that my mom in the beginning, she wanted to be like a hush hush thing, and she didn't want any other family member to know what I was going through. And then I was like, you know what? I'm going to do the fucking opposite of what you told me. So, you know, I informed all my cousins. I told them exactly what happened. And then I started this podcast because I was like, you know what? If I can't find someone who looks like me, I can't find someone who comes from like a similar cultural background, then I'm going to make my own fucking podcast, because I'm going to be the change that I want to see in this fucking world. And so I'm going to do it. And that's essentially the passion and the anger that happens of why this podcast started in the first place. But going back to the Kelly Clarkson show, I think that's when my parents knew, like once they saw the segment, that's when they knew that like I had a purpose and I was creating something bigger than what they didn't know, right? And then I also took my mother to the Breasties camp. Breasties, I was doing like a talk there about career, and I really wanted to bring her because I wanted her to see that there is a community of women who are speaking out about their stories. They are not afraid to share what they're going through, and everyone comes together, and it's not this hush hush aspect. You're not alone in this. And so I wanted to show her that. And I feel like she's gotten like she has like a bigger perspective on things now, especially with speaking more about your journey and talking about it, and it's not seen as a weakness and all those things. So I really really wanted to ingrain that with her, and I feel like your parents probably saw the same thing too, that this was a big thing, especially since you were on the Kelly Clarkson show.
I'm a Caucasian woman, like I come from Caucasian parents, but I think just basically speaking on just on all of our parents, you know, having to put that brave face on. We put that brave face on because we don't want to scare anybody. And I think it also comes from a sense of us wanting to also put that brave face on for ourselves. Okay, we got this. We're going to get through this, you know, kind of not toxic positivity, but I think just like almost if I put on the face, then I can encourage myself to also play that part. But I flew to LA, filmed, and then told my dad and my family the day that it was on TV. Like I didn't keep it a secret because I was ashamed of it. It was just something that I wasn't doing it for them, or I was doing it for like our community really. But I don't think that they realized how hard it was too until like after the fact, and like seeing us on that screen, like you said, your parents didn't realize like how painful that was for you, and like seeing you cry and like sharing all that like raw emotion. Like I don't think any of our parents really did.
Now listening to how you being on the Kelly Clarkson show just made your parents realize how much it has affected you. And I am like thanking the universe right now, because I think like we reached out to you. We reached out to anyone and everyone who can talk to the producers, but we didn't really know like exactly what they're going to do with your information. But I'm glad it was you, because now that changed your relationship with your parents, because they weren't able to get it in the beginning, right? But they were able to get it when you're on the show, right? So that's completely different.
I'm sure, yeah, I'm sure at some point they would have seen it, because now like they'll read like other things that I do or other things I've seen, but I'll never forget like that moment where they were watching it and they were turning and they were watching, and I was like, I don't want to look at you, like I don't want to listen to it, I don't want to see it, like turn it off. But they were so excited. They were like, no, we want to see it. And I think they thought it was gonna be something different, but I knew what it was going to be because I had been there and I knew that I had cried and I knew that it was so emotional for me. And they're like, they looked like they were going to cry. Like I wanted to hug them. I wanted to, like you said, like almost like protect them. But I was like, now we know. Now we're all on the same page. Like, we know. And I remember my mom's just said, I didn't know how hard it was for you. And I remember like, it was just such a moment where we were all vulnerable. And so yeah, it was nice. And now they're very supportive. Anything I do, they're my biggest cheerleaders. Like, you should share your story. I'm like, thank you. So it's nice.
Love that. I love that.
And I love that it was you two on the show, because we get to have this bigger conversation now, which is so important.
Thank you so much. Thank you.
So let's go back to your health literacy project. We talked about how 95% of Latinas did not do a mammogram or any other preventative care. You and your team wanted to create something, right, to make that change. So you started a series called Cafecito, and if anyone who doesn't know Spanish, it's like Spanish slang for like little coffee or Cuban coffee. But it was just an informal meetup where Latinas get to meet with health advocates or medical professionals to discuss the topic of preventative risk, such as diabetes, breast cancer, colon cancer, and the importance of screenings like mammograms. So I know you talked about that the participation was small, but then it grew to 25 people. So how were you able to expand that and reach that type of engagement within the community? Because I feel like at first it was probably really difficult to even bring them in the first place.
So again, we were providing free services, right? We were providing like food, and I was like, oh, wonderful. Like, I would want to come. Who wouldn't want to come? Nobody would want to come. So it was like 2 people. And again, like, you're talking about things that are very difficult. You're talking about diabetes, which is very prevalent in the community. You're talking about breast health. You're talking about mammograms. You're talking about colon cancer screenings, and, high blood pressure. These are all things that the community struggles with, and they know that, and they don't really want to talk about it because they already know, and it's hard. But we wanted to kind of bridge that gap. Like, how can we bridge that gap between but now let's get you involved in changing kind of the behaviors, or connecting you better, getting you better engaged with your health, like being your own advocate and asking questions and being an active participant. So honestly, it was a lot of teamwork between the providers, like the nutritionist who spoke Spanish, the social workers who spoke Spanish. First, I wanted everyone on the team to be Spanish speaking, because I felt like that would be a more engaging, informational session. And also for it to be like relaxed, not to feel clinical. So it's kind of that informal, like, have a coffee and like chat. So like, okay, let's do something like that, where you can have a coffee and you just chat and you get all your questions out. So come have a cafecito, and everyone's going to speak Spanish. But we needed a lot of community outreach. So what drove the engagement up was community outreach, going out to, there's a chain of Hispanic markets, and like going there and like having them, like, are you aware, like, we're having these, like, you can come by, and like, they're free. And like, also the clinic is free, and we have these services that are free. And one by one, more and more people would come. So word of mouth, community outreach. We also worked a lot with like the Mexican embassy, with Univision, but it took a lot, and slowly more and more people would come. Also, if they see consistency, if they see like that there are 2 or 3 people that are always there, they're like, okay, these people really care. And I think that shows them something too. As a patient, if I see that my provider is like really dedicated and getting me to do something, then I'm going to want to, maybe try, because it seems like they really want me to do it. So I'll try. And I think that consistency really helped too. So consistency, community outreach, and getting people who spoke the language, basically.
I love that, because then you're trying to set people up for success with doing everything that you just mentioned, everything where you can bring someone in order to get educated and to have like the resources that they need to take care of their health. You mentioned about the nutritionist, and I'm curious, maybe if you can dive a little bit deeper with this, but what were the strategies and the initiatives like maybe the nutritionist or maybe you tried to implement to encourage healthier choices?
This was more targeted for like high blood pressure or the diabetes
Yeah.
population, but this is, and again, so because it's predominantly like a Latino community, there was a lot of high blood pressure and diabetes. And so it's not about like you can't eat, you can still embrace Mexican cuisine, but in a different way. So we want to get you away from one soda with every meal, which is what we would see, like having a Coke with your meal. Instead, maybe try sparkling water or try like water with some lime. Not having as many tortillas. And this is another big one. And it was a lot of people would be like, no, we don't want that. And like, okay, well, let's try. Or maybe we could do this. And again, the classes were all in Spanish. And we also had cooking classes. So we would show them actually like, this is what you can make. This is what you can do. And there's a lot of, I'm not saying it was fully embraced. There was hesitancy, when you try to say, this is what you can and can't do, try cooking with olive oil instead. And habits are formed over time. And so to kind of change those habits takes time. But again, diabetes and high blood pressure were big things that we were trying to tackle. I want to say over something like 72% of the population had high blood pressure, and over 65% had diabetes, type 2 diabetes. And when you combine those two, you're at an increased risk of stroke. So that was what we were also trying to kind of relay, not as a way to scare anyone, but just to say, but this is in your control. These are things you can do. You can change the way that you eat. You can try to get more exercise, and we can help you do these things if you are interested.
Did the clinic also provide like gynecological exams?
The great thing about this is that it was considered a patient-centered medical home. So there was dental services, mental health services, medical services, social work to get you connected to like insurance, housing assistance. So it had like all in one, and financial assistance on the issue. So like if you could not afford it, there was a way around that. Also pharmacy services. So everything was included.
Incredible. So I'm assuming, obviously, if talking about your breast being like a sexual organ, like vaginal health and gynecological health and all of that, it's got to be just as taboo.
The same thing that we had seen with mammograms, we were seeing with pap smears. A lot of women had never had pap smears. They would say like, no, I already had my kids. I don't need one. I'm like, well, that's not exactly how it works.
I love how you created such a unique type of informational thing where it was geared towards the Latinas, but you tried to make it where, for example, you mentioned about the cooking classes. It's not a generic cooking class. Like you try to ingrain like their culture into it too. And that's really important because you want to create a program that's geared to that specific group of people. You can't have the same set of resources for everyone. I feel like that's not health equity. Health equity is creating a designated type of resources to fit what that group of people, that minority group of people need. And so I thought that was extremely incredible that you guys were able to do that.
I think it's really important. That only would have been possible if we had people involved in the decision making, and this is why health policy is so important. Something like that is only possible if you have people involved in decisions who understand. So, for example, our nutritionist, the chief medical officer, if everyone who was on the board had not, like if we didn't have seats at the table who were on board with doing something like that or who understood why that was important, we would have, because I had worked at another clinic about 8 years ago where we had cooking classes for the community, but we were teaching them how to make healthy pasta and healthy pizza and salad. And that wasn't adopted into the community. It didn't work. And so when I heard that we were going to do I was like, let's do something like this again. And we all had the same idea, but let's make like a healthy pozole and like healthy tamales because that's what they're going to eat. That's what they want to eat. That's what they like to eat, but let's make it in a healthy way. And I would tell like my grandma and my mom about this, and they were laughing because they were like, I know, they're really doing it. And I was like, yeah, they're really doing it. They're really like, they're embracing it. And that's why representation matters. That's why being involved in the decision-making matters. That's why a seat at that table matters, because it would have been like that other time where it was like, well, let's just show them how to make pizza, and then patients are not going to listen and they don't want to eat pizza.
Yeah, it's just like taking exactly what they are doing within their culture and trying to just fit that into the resources that you're trying to provide to them, right? Create like a program that obviously fits the needs that they're already eating or doing. And I feel like that's so important. So I really, really love that you and your team were able to do that. But let's talk about your goals and aspirations for creating better policies in healthcare, improving health outcomes, particular with the minority groups or with young people who are affected by breast cancer or just cancer in general.
So I think whenever we talk about health equity, and I think that's really been kind of the focus over, if I haven't done it intentionally, it's definitely been intentional, I think, in the last year since I've come back to the US. But whenever we talk about health equity, I think the two most important things that come up are affordability and access, right? So when I was working in these clinics, do people have access to screening? Do they have access to providers that speak their language? Do they have access to the resources that they need? And I think that it's not an easy fix. It's sort of a broad goal. It's a big goal. I think a lot of people have very similar goals in healthcare and health equity. It takes time. It takes time and it takes teamwork, like I saw and like I mentioned. But luckily, a lot of people want the same thing. And I think that's also really nice to see, is that a lot of people want to build healthy communities and see that gap bridged in health equity to where people don't have to choose and don't have to feel like they don't understand. So I guess my goals would be to see that. I think I look back on my own experiences, whether it's been as a patient, whether it's been being a caregiver for my mom, or in conversations I've had with my grandmother, and I see where we could do better. And I guess that's my goal, is where can we do better?
Yeah, no, absolutely. And, a part of that could also deal with people who have higher level job roles. And so I'm wondering, in your opinion, what can these community leaders or organizations could do to better support the minority groups and to have more of a supportive area where they do provide the resources for people who maybe don't even have it in the first place?
So it sounds really simple, but I would say listen. We could just listen. There are some times where I don't even know. My mom is Mexican, but I grew up in a very white neighborhood. And so there are things that I'm still learning. And sometimes, and I'm not afraid to say, I'm not really sure. I don't have all of the answers to the Latino community. And so I listen and I ask. And I think that we could all benefit from listening to what patients need and what the community needs. And it's okay if we don't have all the answers, but we need to listen to the community. It's their community, it's their healthcare. We need to listen. And I've been in conversations where sometimes it's not always that way, to put it mildly. Like, we're in a room of 10 people, they're making decisions without actually asking first, what do they actually need and what is actually out there and what would actually be beneficial. Something as simple as the cooking classes. That could have almost not happened, because if someone hadn't had the foresight to think about that. And like I said, luckily we had a nutritionist and like a lot of people on the team who were like, this is what we need to do. But like, those conversations need to happen where we like stop and ask and listen. I see it not happen enough.
And I think that they need to see on their end the day-to-day that people are facing, right? In their neighborhoods that they're living, where the grocery store or the supermarket that's right around the corner don't have healthy foods that you would normally get at like a Whole Foods or, like one of those high tiers grocery stores. So I think even just like understanding what can they have in terms of the resources and what they can't have currently because of everything that they themselves are living in or don't have the ability to do, etc. So I think that's super important. I think for the Latino community, understanding that the Latino community, they're a diverse population. There's so many different types, right? So there's people who are immigrants who moved here to the US who don't speak the language. And so they need a lot of hand-holding. I think I read somewhere online, and I can link it in the show notes, that they prefer that they go in person to fill out an application or be on the phone to talk to someone to help them guide through whatever they need. They can't do it themselves. And I feel like we have to understand we need to do. I certainly need to do that for my parents. So I think just learning about the diverse population in the Latino community, I think is like a first step. Secondly, I think we need to tailor the messaging as well. So for someone who's an immigrant, we need to kind of tailor the message in the way that we advertise to fit the molds that they need, versus maybe someone who's you and I, we're first gens, and so we have a little bit more of an understanding, and so that message would be completely different. So I think definitely they need to think about that and know that, and they won't know it unless, like you said, they listen or they see what is going on. Addressing the stigma around cancer in the Latino community, we talked about it a lot, but I feel like it requires just a multifaceted approach. We talked about increasing awareness and education about cancer prevention, early detection, treatment options in a culturally appropriate ways. We talked about having an open and supportive conversation about cancer within families and communities. You mentioned about health equity and ensuring everyone receives the care that they need, providing language access services, engaging community leaders to break down those barriers and promote cancer screenings and education. And I think lastly, encouraging cancer survivors who are Latino to share their stories and to become advocates for themselves. So I think that's a huge part, and there's always room for anyone to share their story. I think that's so important. The more people who have like a similar background to us and be able to talk about the story, the more people that we can reach and the more open we can have the conversation and around cancer, and to not have this like fear base around that. But wondering if you had any other points that you wanted to make.
I think just to touch on that, I absolutely agree. I think a reoccurring thing that we kind of mentioned was just awareness and like sharing and discussing and talking about it. And just in my own experiences, what I've seen is, every time we bring things up, we talk about them, we share them, even just within my own family, it does make it scary at first. It does make it better though. That's how I met you, right? That's how I met you guys, was just hearing your stories, hearing your journeys. And I thought, oh, there you go. There's someone like me. And so there's so much power in talking about what you're going through, because then you're not alone. And so I 100% agree with that.
Yeah, no, definitely. Anything else you wanted to tell the listeners before we close out?
I think this was just we just unpacked a lot, and it was just such an honor to be here with you both. So just thank you so much for having me. And I think that's pretty much it. So it was just a pleasure talking to you.
Yeah, it was wonderful speaking to you. I'm so glad we were able to do this. And I'll put your handle in the show notes too.
Well, thank you. Thank you both so much. Thank you.
A very special thanks to our podcast producer, Bethany Allard, and our podcast editor, Ayla Anderson.
Thank you all for listening and supporting our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoyed this episode, please share it with your friends and fellow breasties. Help us reach more women by subscribing and rating us on Apple Podcasts, Spotify, and now on YouTube. You can follow us on Instagram at TYFTS Podcast and email us at tyftspodcast@gmail.com. We love hearing from you guys, so shoot us a message. We will link any resources from the episode in our show notes.